I'm alright. Oh snap, what up Z-Pack? It's your boy ZDoggMD. Check it out today. Ow, this phone. Today we're going to be talking about something near and dear to all of our hearts, and that is people who come to the ER and don't need to be in the ER. Oh my gosh, Tom Heineber, what a horrific pain point, not just for the staff of the ER, but for the patients who expose themselves to germs and boogers and nasty things in the emergency department, and for our healthcare system, which has to absorb the cost of the most expensive place to be seen, which is the emergency department.
Well, I heard that a hospital in Georgia already solved all this, see?
You heard wrong, because it's actually a health plan of Georgia, and they didn't solve ish, okay? This is the story. Pull up the article there, Loganio. There it is. Blue Cross Blue Shield of Georgia to launch emergency room policy. Now, okay, let's start by saying Blue Cross Blue Shield is an insurance company, not a clinical entity. So they are launching an emergency room policy. They are not doctors, most of them. They are an insurance plan. So this is where it gets interesting. This is what they're doing, guys. Starting in July, health insurance provider Blue Cross Blue Shield of Georgia will stop covering emergency room visits that it deems unnecessary. And doctors and analysts have a lot to say about it. So this was, I think, an NPR piece. What they are doing is because they don't want people using emergency room as primary care, okay, but they're not willing to pay for primary care properly. The cost of care has been going up much faster than people's earnings. We have got to find a better way to do some of this stuff and taking some of that unnecessary spending out of the system, says Jeff Fusilli, also a pasta, and also the president of Blue Cross Blue Shield of Georgia. Now, he said that the insurance provider wants patients to use urgent care, retail health clinics, and their Live Health app. By the way, Tom, I'm going to guarantee you right now their Live Health app is a piece of crap, because every single insurance company app is a steaming piece of crap.
Yeah.
Nobody wants that.
Also, healthcare.gov, you suck.
Healthcare.gov, okay, it tried really hard, Tom. Tried to bring healthcare to the masses. You don't know healthcare.gov. Okay, so it's a mess, all right? But here's what he's saying is basically what this policy is directed at is regular run-of-the-mill colds, maybe even influenza. But you don't need to go to the emergency department to get tested for whether or not you have flu and to get a Tamiflu prescription. Jason Hockenberry at Emory, who teaches health policy, says he's found people often use the emergency room inappropriately. I love it. You have to be a health policy professor to know this. Oh, thanks, professor, for stating the obvious. Of course people use the emergency department inappropriately. That is the nature of how people use the emergency department. That's why our Doc Vader clip about him talking about some coming in for a hangnail in the emergency department had like 10 million views, because it hits a nerve with caregivers, especially frontline ER providers, because they're seeing abuse and misuse of the system. So here's the question. Blue Cross saw a problem. We're spending too much money treating colds and coughs and minor stuff in the most expensive place to do it, which is the emergency department. So here's our plan. We're going to use a big, heavy stick, and this is what they said. If you come into the emergency department for something non-urgent like a cough or a cold or something like that, you will not get reimbursed for your bill. Now, Tom Heineber, I've been to the emergency department as a patient. Those bills are not small. Those are very large bills. If you come in for a cold, your minimum bill is going to be $500 minimum. And so this is a big deal. It's telling people, make the wrong choice, your wallet's going to be broke. Bring your kid in because you're worried about a fever. Maybe you didn't have a primary physician or you didn't talk to your primary physician. Oh, don't you dare call me when I'm live casting phone. Oh my God, I'm so angry right now.
But see, all right, here's the thing. How can they just charge you without telling you the price? I don't think we'd ever let that fly in any other industry.
I'm still angry about my phone. Well, no, now that I'm mad, let's talk about this. So you come in for your fever, for the kid, maybe doesn't need to come in, just would have responded to Tylenol. Fever below 104, would have responded, could have seen the pediatrician in the morning. Didn't, comes to the emergency department. You don't know in an emergency department what you're going to be charged, because they do all kinds of different things to you, and they charge it as line items based on a charge master, which is this master evil billing thing that is basically calibrated up because they know insurance companies are only going to pay this. So they end up cranking up the price for people who aren't having insurance or have high deductible plans, et cetera. So in the setting of that, you come out with a bill that you have no idea what it is going in. It's not like anything else, right? You go in, maybe legal fees. You never know how many hours it's going to take, right? And you come out with a $5,000 bill. So a good example was I was hiking in Red Rock. I took a stumble down, scrambling down some rocks. Wow, hit my head, bam, right there. You see that? That's the scar from that. Happened 4 years ago. Just moved to Vegas, didn't have a primary care physician. It was after hours, it was in the evening. The urgent cares were either not open or I didn't realize what was going on and I hit my head and I was a little bit out of it. And I had a friend, took me to the ER. I got 3 simple stitches and a tetanus shot. It cost me $4,000. They asked me to do a CT scan. I told them to F themselves because I didn't want one. I didn't want the radiation and I felt fine. I did a neuro exam on myself and I'm like, dude, I'm fine. So I basically had stitches and a tetanus shot. That could have been done in any urgent care, could have been done in a good family practice doctor's office, and it would have been nothing. The tetanus shot's normally $30. You know what the line item charged me for, Tom? Without any disclosure of what it cost, $350. Now, there are 2, and so each stitch was $1,000 and then the tetanus shot. And then not only that, but the ER provider, the ER doctor, they don't like to be called providers, who treated me was out of network for my insurance. Did I get to choose them? No, it's an emergency doctor. So since it was out of network, I got charged extra and the insurance wouldn't cover it and I had to go through this whole process. Now remember, I have a $6,500 high deductible family plan to make my insurance coverage affordable for me. And that means that I paid the entire amount out of pocket. I had no idea going in and I'm a physician, right? Now, did I screw up? So what Blue Cross is saying is, look, you should have known that urgent care could have done this for you. And we're going to look at that bill and go, you know what? You never should have gone to the emergency department. $4,000 out of your pocket and it's not going to tick towards your deductible. Holy crap, that's a big deal that an insurance company would make that decision. Now, in the article it says, in response to that criticism, because a lot of docs piled on and said, so you're going to tell me that I come in with what I think is chest pain, I end up diagnosed with indigestion, and retroactively I get a $5,000 bill for this big cardiac workup that was negative. And what Blue Cross said is, no, we're going to have a panel of actual doctors reviewing these cases and making sure that it was a legitimate reason to come to the emergency department, even if it turns out to be bogus in the end. So here are 2 sides to this story. And I will be honest with you, Tom, my initial draft on this, seeing this, was good for Blue Cross. Finally, somebody standing up to ER abuse and misuse, and they're going to hit people where it hurts, which is in their pocketbook. Then my immediate second draft was, oh, no, you didn't, because you are now taking technically non-clinicians and you're making clinical decisions. And what's going to happen is you're going to actually dissuade patients from coming into the emergency department because they're going to say, you know what, I might get a big ass bill. I don't know if this is appropriate. I'm going to tell you right now, people, doctors in the heat of these things often can't 100% tell you whether it's a good idea to go to the ER or not. There's gray areas. If I can't tell you, then how the hell are you as a layperson supposed to know? And then you end up getting hit in the pocketbook because you screwed it up. So this is the problem. ER overutilization for coughs and colds and hangnails and bullish is a huge problem. But is the solution to have Big Daddy Insurance then say, well, we're just not going to pay for it if you screw it up? How can patients be expected to make those decisions?
If you need to ask if you need to go to the ER, isn't that reason enough that you don't need to go to the ER?
Hell no, hell no.
That's a great question, Logan, actually. If you need to ask, isn't that a great, no, because I will tell you, people dying of heart attacks will ask, do I need to come for the ER for this? I have this vague chest pain, I'm a little short of breath, my jaw hurts. Is this something I can just sleep it off? So
consequently, people will be like, Doc, the skin on my elbow's really rough.
It's rough.
Do you think I should go to the ER right now?
We need some lotion.
Bingo. People don't know, and honestly, I'm going to be honest with you, I don't blame them usually. There are some people who abuse it, but mostly it's just an education issue and an access to a primary. Logan, you're a pediatrician. Told you, if your child has a fever, call them first no matter what time it is, and they will answer your call, right?
Yep, any hour of the night.
Any hour of the night, because they don't want you to go to the ER with your kid for an unnecessary reason, and a lot of fever in kids is unnecessary. Some isn't. It does take a physician to make the decision, or a good triage nurse, but you need that. Now, here's the thing. It's Blue Cross patients are these are the ones that are targeted, right? Now, are the Blue Cross patients the ones that are costing most of this problem?
Yeah,
in
that's
emergency
the elephant
department?
reaction I had, is this is going to penalize middle-class families who are worried about their children.
Right.
It's not going to penalize the homeless and the drug seekers and the people that are really abusing the system, right?
Well, so that's the thing. So it's certainly not going to affect people who have no disincentive to using the emergency department. Say a patient on Medicaid, where let's really dig into this, Tom, because why would somebody go to the emergency department instead of going to an urgent care or primary care's office? Since the emergency department is filthy, it's scary, you wait forever, you get treated like crap because they're so busy a lot of the time. Why would you do that? Well, part of the reason is it's a financial reason and it's an access reason. Many people, especially people with the lower insurances or no insurance, don't have a primary care physician. And if they go to urgent care or one of these clinics, retail clinics, they have to pay up front. And that is a huge dissuasion when you're trying to decide, do I eat or do I go get looked at for this, whatever it is, cold or flu or chest pain or amputated foot. So it's a very complicated issue that has a lot of socioeconomic pieces. It has an educational component. It has a huge financial component. All that's woven together. So should we just let Blue Cross try to use carrots and sticks to influence this?
No.
I'm going to say no. But I'm going to say yes to I'm glad they did it, because now we get to have the conversation and say, are there better ways to actually influence this?
I just think the business model is insane. Imagine if you ran a piñata store, it was called Emergency Piñatas, and you were like, bro, I need hella piñatas right now. And the guy was like, okay. And then 3 months later, you got a bill for $10,000 per piñata.
Well, this is obviously the concern in medicine in general, that this charge master is totally bogus. We should have price transparency, but that's a whole nother talk, Tom.
Yeah.
It relates to this, right? And it relates to why I got a $4,000 bill for 3 stitches and a tetanus shot, and I'm a physician and I know the CEO of Summerlin Hospital, and I should never have been charged that, but I did. I was, and I paid it because I want to be a good citizen, and also I wanted to talk about it forever, about how I got screwed. But to some extent, you could blame me. I didn't go to urgent care. Right? Should I have known better? Well, it was 7 at night, and I'm new to the town, and I don't have a primary physician, and I've just had a big bonk on the head. Well, So there you go. But here's the thing, there are other ways to influence the behavior of patients in using the emergency department correctly. One is education, public health programs. The second is actual access to primary care that is health 3.0 prevention minded. Our turntable patients, we were able to show with our partners Iora Health a 50% reduction in ER, urgent care, and inpatient admissions. Why? Because they came to us first. They developed a relationship. They knew we cared. They had 24/7 access to us, text, email, Skype, phone, however they wanted to communicate. And they had a relationship with us, so they knew they would call us first before they show up in emergency. So having that relationship means you need a good resource primary care. If Blue Cross wanted to save money, what they would do is not penalize middle-class people who are paying a shice ton for insurance, already have a huge deductible, and get crappy coverage. That's not what they should do. What they should do is pay frontline primary care physicians to operate Health 3.0 outcomes-driven clinics that connect with patients and keep them out of the emergency department. If they did that, they would save so much money, and we showed it at Turntable, and yet they want to do this instead. Now, I understand you got to start somewhere, but this is not going to work. Go ahead and do it. Do it as a trial and watch what happens. People are going to stop utilizing care, and there's going to be events where you miss something tragic, like an aortic dissection. They didn't go in because they were worried about that getting charged, and they're going to die. And then it's all going to change.
You tell them, Z. Also, shice is not a word.
Listen, this is the main incident report. We don't curse on the main incident report, and that brings me to the next level, guys. Come back in about 2 minutes, and we are going to curse up a storm, because we're going to take your comments. We're going to dig deep into, should insurance companies not pay for inappropriate ER visits, what they deem inappropriate, and how do we solve the problem of emergency department overuse? We're taking your comments. We're cursing, so put the kids away. And it's so on right now, Tom Heineberg.
Basically, we're going to talk hella shice.
I hate you so much, Tom Heineberg.
I'm alright. Uh-huh.